All right, well, good morning, everyone. Welcome to another edition of High Rounds. My name is Marvin Hanashiro, and I'm your High Rounds administrator. So you always get all those emails from me. So today we have something a little different, and I'm really excited because we've invited 4 different representatives from the various HIV research groups at UC San Diego to come and speak just a little bit about some of the research studies that they have ongoing. So I'm going to introduce everyone for their turn. And then I'd like you to say something a little bit about yourself as well as your organization. Everyone's going to get about 15 minutes for their presentation as well as Q&A, and then we'll move on to another person. So to get us started, we have Dr. Angel Algarin today.
Hello, everyone. Nice to be here, and thank you for your attendance. My name is Angel Algarin, or Algarin. No, both are perfectly fine. And I'm a T32 postdoctoral fellow working under the mentorship of Laramie Smith in the Division of Infectious Diseases and Global Public Health in the Department of Medicine. And today I'll be talking a little bit about our project Nexus. So I want to start off with a little background of what is stigma. So stigma is a fundamental cause of health inequities. It has various sources coming from potentially friends, family, healthcare providers, takes different mechanisms. So experiencing discrimination versus perceiving stigma within your community. And we also have different types. So talking about race and ethnicity in the form of racism, sexuality in the form of homophobia. So while qualitative research has suggested that overlapping or intersectional stigma has a compounding effect on the deleterious impact of stigma on health, little has been done to quantitatively try to examine intersectional stigma. Sorry about that. So the Nexus study is a National Institute of Mental Health funded research study examining intersectional experiences of social support and stigma among Latino, gay, and bisexual men who have sex with men on HIV prevention and other health outcomes here in San Diego County. We're currently partnered with the LGBT Center and San Ysidro Health. To be included in our study, participants have to be older than 18 years of age, Hispanic and Latino identifying, a man who has sex with men, and HIV negative. So the study consists of 3 study visits over 12 months, and participants can earn up to $360 for their participation. So a bit about the study timeline. At month 0, participants present an HIV negative test, and an initial baseline interview takes place. At month 3, participants receive a phone call to check in on that information that they have provided at their initial interview is still the same. Then we have a month 6 second interview, which is similar to that baseline interview. We have an additional follow-up phone call to keep participants engaged at month 9. And then at month 12, we have that final interview. So why does this matter? Why does looking at stigma matter in an intersectional way? So by studying how Latino men who have sex with men experience intersectional stigma in their social networks, we can develop interventions to improve HIV prevention by reducing stigma. Specifically, participants' responses will help us learn who's more likely to stigmatize and who offers support against that stigma. And in what social context is stigma most harmful? Lastly, where do men who have sex with men most often experience this stigma? So if this is a study that you're interested in or passionate about in ending stigma, we're asking for people during this phase of our ongoing recruitment, what we can do to help. So any introductions to providers who normally serve this Latino men who have sex with men population would be great. Inviting us to attend a table or event with large Latino attendance. Let us know about any community events that might have large Latino attendance. And please inform us if you know someone that might be interested in the study. And then additionally, posting a study recruitment flyer in waiting areas or patient rooms or on social media, that would be great. So if there are any follow-up questions about the study that I can't address today, here's some contact information of the PI and and Aaron, who does most of our Nexus outreach. We also have an Instagram page at Nexus_UCSD. But yeah, thank you for your attention.
Thank you, Dr. Algarin. Did anyone have any questions? Well, for now, Dr. Algarin, if you want to, go ahead and put your the contact information maybe in the chat, so that way people can always copy and email you later, maybe if they have any ways they can help connect you to some of these events or other opportunities to help with outreach.
Thank you very much.
Great. Well, thank you very much. We're going to move on then to our next presenter, which is Anthony Coronado from MCAP.
Hello, everyone. Thank you for having me. My name is Anthony Coronado, and I work with UCSD with the Mother-Child Adolescent program. I am the study coordinator for OPEN, which I'm about to give you a presentation on, as well as helping with MCAP's outreach efforts for at-risk youth and at-risk women, and hopefully finding individuals that are out of care and getting them back into care for HIV treatment. So that's exciting and new front for MCAP. But right now I am presenting on OPEN. So let me go ahead and share my screen. I believe it's this one. Oh, that's not the right one. Can you guys see my screen? Okay.
Yes.
Is it?
Although it's in presenter view.
That's what I thought, and I was like trying to get out of that. Come on, let me fix this. I'm sorry.
No problem.
You were good. You just had it.
Oh, no.
Yeah, you just needed to put it in presenter mode.
There. Do you guys see it?
Yeah. But you're in the wrong view.
Yeah, I know. I'm trying to get out of that.
Just go down to the bottom of your screen and hit on the little thing that looks like a projector.
Can't see it.
It's just over to, before you get to, keep going, over that one.
Thank you.
There you go.
Sorry. So, well, technical difficulties aside, so thank you for having me here. So I am presenting on onboarding positives and PrEP users to engage negatives. So the objective is to develop and pilot OPEN, a peer-driven social network intervention to facilitate PrEP care engagement among YMSM men of color, specifically Latinx and Black MSM. So to address age and racial and ethnic disparities in PrEP use among MSM, we're developing and piloting onboarding positives and PrEP users to engage negatives, or OPEN, which is a peer-driven social network intervention to facilitate PrEP care engagement among Latin and Black MSM. Our central hypothesis is that training YMSM who are engaged in HIV or PrEP care as PrEP educators will position them as credible sources of PrEP information who can influence PrEP care engagement with their social networks through their ability to share culturally competent PrEP messages in the context of their personal experiences, navigating healthcare system, medical mistrust, and stigma to support their own care engagement. Next slide. So currently we are enrolling individuals into PrEP. We just launched the pilot RCT. So as you can see from this slide, we are recruiting 70 individuals that are in HIV care, and well, 35 individuals that are in HIV care, 35 individuals in PrEP care, 70 in total, and they will be randomized in these two arms of the study. One will be for OPEN, and the other will be for another intervention that is equally timed. And so we are currently enrolling for that. Both the interventions and control conditions will consist of 5 weekly sessions on Zoom facilitated by a trained health educator. All other study activities will take place at MCAP at the end of the 3rd session, and indexes in both conditions will receive coupons to recruit YMSM of their peers of color and their social networks to the study. Eligible peers who present at MCAP and want to participate will then go under HIV testing by me. And if they want to go ahead and continue on with the study, they will then enroll into PrEP app if needed. If they have healthcare insurance that requires them to say go to another facility besides Owen Clinic, then we will work with them to ensure that they do get their first appointment, attend their first appointment, and then we will follow up with them within 3 months to make sure that they are still on PrEP. And so the beautiful thing now is that MCAP could actually do PrEP app enrollment at the MCAP site. So everything can be done there by me. So hopefully they will walk away with an appointment that day. So that's very fun and exciting. Next slide. So the open recruitment, like I mentioned before, we are recruiting 18 to 29-year-old Latin, Black, gay, bisexual, and other men who have sex with men who are engaged in HIV care or PrEP care to participate. So individuals that are receiving HIV care and PrEP care, they have very similar healthcare journey, if you will. So they're better equipped to go out and talk to their social networks, talk to people they know that may benefit from PrEP. And so they could really encourage them and give them the motivation they need to go actually access those resources. And so we're very excited to launch this. Like I mentioned, we just started recruitment. So if you know of anybody that would be beneficial for this, please send them my way. I'm going to add my email into the chat. I'm going to go ahead and add the index flyer or the study flyer in the chat as well. Yeah, just if you have any questions, please email me. I'm happy to respond. If you have an organization that would like the flyers offhand, I'm happy to print them out and bring them to you. I think that's about it. And this is our study flyer. So this is what we use to help recruit individuals. Right now I gave them to Owen Clinic, and they're up at MCAP, and so hopefully we can start getting people to come in and recruit. I'm sorry. Okay. Well. Do I have an echo? No. All right. Well, I think that's about it. Does anybody have any questions?
Actually, I do have a question. So this applies to you, Anthony, and Dr. Algarin. I noticed, and for both of these studies, they are somewhat recruiting similar populations, Latino, MSM. I know that Open Study is also recruiting Black MSM, but I'm curious to know what are some of maybe your more successful recruitment methods so far, and then maybe I know that there's a slide that Dr. Algarin shared about like future opportunities, but maybe what is an area of need that you see that you can really use help with currently?
Yeah, definitely. I really feel getting providers to who have patients that are either on PrEP or in HIV care that feel that they would be good for the open study to refer to us. And if there's several ways that they could go about that. One is they could give them the flyer and they could tell the patient about it. And if the patient contacts us, then that's great. But if the patient would rather be contacted, then I would have to supply them with a consent to contact form. The patient would fill it out, and then I would go pick that up. So that way I have permission to contact the client. So that's another way to do that. But more than anything, I would say it would be definitely providers giving that referral, talking to their patients about this study and how this could really benefit their social network and their friends, and really just drive PrEP use up. I feel like that would be like the number one for me. I don't know, what would you say, Angel, on your front for Nexus?
Yeah, so luckily in working with community partners like the Center and San Isidro, we've had, that's where we've done the most of our recruitment. But I think as everybody knows is that we want to increase generalizability of our sample. So being able to have the opportunity to recruit in multiple different locations would be really beneficial, and is the reason why having healthcare providers that work with people of this population, assisting us in any way possible to getting to recruiting would be great. We also do some social media outreach as well, but I think that the most effective has really been working with our community partners and engaging our Latino men who have sex with men.
So there's a question actually in the chat, which I think is great. It says, would it be possible for one individual to participate in both of these studies? And are there any plans to develop an analysis of the intersection of these two studies?
That is honestly, I think, Angel, maybe this would be a good question for Dr. Smith and Dr. Pines, or that would be, yeah. So I could definitely
Sorry, I'm here.
Hi, Heather, I didn't know you were here.
No, that's a great question, and I'm happy to answer it. And yes, absolutely. We are so I'm the PI of Open, and Dr. Smith is the PI of Nexus, and we're both on both studies. So there's lots of sort of synergies that we're trying to develop and collaborate in terms of recruitment. And participants can absolutely participate in both studies. And we have questions on both of our questionnaires to understand if people are sort of cross-participating, which will allow us to do the kinds of analyses that you're talking about to understand this intersection between the two studies. And there's a possibility that participating in Open could then influence sort of the dynamics of stigma within one social network. And so they would want to be able to control for that in the Nexus analyses, and vice versa. So we are really excited about these studies and the ways that we can work together. So if you do have somebody that could be eligible for both, we're more than happy to enroll them in both.
Great. Well, that's good to hear. Always got to make sure that we're doing our best to collaborate and find synergy, right? So, all right, are there any other questions for Dr. Pines or for Anthony for the Open study, as well as Nexus? Okay. Well, then we'll go ahead and move on to Rose Ramirez.
Good morning, everybody. Okay. Can you guys see everything? Can you see the slides?
No,
Not yet.
not yet.
Okay. How about now?
I see your desktop.
See my count. Oh.
Just bring the PowerPoint to front.
It won't. Just a second. How do I bring it to front? Hold on 1 second. Okay, figured it out. Can everybody see it?
Yes.
Yes.
Okay, perfect. Okay, so my name is Rose Ramirez. I'm actually a study coordinator here at the AntiViral Research Center. Some of you may know my name from stalking you on Epic, trying to recruit patients. But the study I'm going to be talking about today is A5379, the enhancement of hepatitis B virus vaccination in persons living with HIV and evaluation of HEPLISAV-B. And this study is sponsored by the National Institute of Allergy and Infectious Diseases.
Hey, Rose.
Yes.
Just 1 second. So what I'm seeing is basically your presenter view. I'm seeing 2 slides.
Got it. Okay, 1 second. Let me try to redo this. Sorry, I have a split screen, so I'm trying to figure this out.
I could be wrong, but Rose, if you go up to the display settings on the top and then swap there.
Genius. Genius. Okay, sorry about that, everybody. Okay. All right. Okay, so background. So while vaccination is the cornerstone of prevention strategies for hepatitis B virus, the response to current standard vaccination is suboptimal in those living with HIV. So several studies have documented overall response rates, which is defined as achievement of greater than or equal to 10 milli-international units per milliliter of hepatitis B surface antibody to range from 30 to 70% following a standard 3-dose series. And the optimal standard response rate for individuals living without HIV is 95%. So we really want to hit that gold standard of 95%. Several studies have tried to improve these response rates with addition of adjuvants and increases in dose or dose frequency. And most of these strategies have proved to be ineffective or marginally ineffective. So the schema for this particular study, it's a phase 3 for prospective open label interventional study with 3 arms. The study will involve adults living with HIV with a history of non-response to hepatitis B vaccination. They'll be randomized 1:1:1 to receive one of 3 arms, either Heplisav-B, arm 1 will receive 2 doses, and arm 2 will receive 3 doses, or Engerix-B, which is arm 3 and will receive 3 doses. This is a 72-week study duration with a total of either 10 or 11 visits, again, depending on which arm they're going to be randomized to. This will include adults older than 18, but younger than 70 years old, living with HIV, with a history of a hepatitis B virus vaccination, who failed to achieve protective levels of antibodies against HBV surface antigen. And again, that's defined as less than 10 milli-international units, negative or indeterminate. So the primary objectives of this study are to compare the week 12 seroprotection response of a 2-dose regimen of Heplisav-B, which is arm 1, versus the week 28 SPR of a standard 3-dose regimen of Engerix, which is arm 3. The second primary objective is to compare the week 28 SPR of a 3-dose regimen of Heplisav-B, which is arm 2, versus a standard 3-dose regimen of Engerix-B, which is arm 3. Then we'll go through regimens. So again, participants will be randomized into one of 3 arms. There was a 4th arm, but unfortunately that has filled up, and that was for people who were hepatitis B vaccination, had never received it. So let's see, arm 1, again, is Heplisav-B will receive 2 doses administered at week 0 and 4. Arm 2 will be Heplisav-B will receive 3 doses administered at weeks 0, 4, and 24. Arm 3 will receive Engerix-B and will receive 3 doses administered at weeks 0, 4, and 24. And then just, this is a basic inclusion criteria. It's quite long. So basic are living with HIV. They have to be on their ARTs for greater than 56 days prior to entry and plan on staying on their ARTs. Hopefully they're stable throughout the study. CD4 T cell count greater than 100 cells. HIV RNA less than 1,000 copies. Again, they have to be aged 18 through 70, and their serum hepatitis B antibody must be less than 10, non-reactive or indeterminate. Now, some exclusion criteria. Infection or prior exposure to hepatitis B virus, which is defined as Hep B surface antigen positive or hepatitis B virus core antibody positive anytime prior or at screening. Anyone who has received Heplisav B anytime prior to study entry is also excluded. So you are able to have been vaccinated with the NGRX series beforehand, or any other available hepatitis B vaccination other than Heplisav B, but it has to be less than 168 days prior to study. Sorry, that's an exclusion if they have been given NGRX prior. They need to, let's see. If their serum hepatitis surface antibody levels are greater than 10, they're excluded. If there's presence of any active or acute AIDS defining opportunistic infections within 45 days prior to study entry, any history of solid organ transplant, current or prior history of clinical hepatic decompensation, any diagnosis of chronic kidney disease, stage 4 or greater. In addition, any cancer diagnosis within 5 years prior to study entry, other than squamous or basal cell carcinoma of the skin, any active serious infections other than HIV or Hep C, requiring parenteral antibiotics, antivirals, or antifungals within 45 days prior to study entry, currently receiving chemotherapy, or currently breastfeeding. My contact information is here for anybody who would like to contact me for any more questions, if you'd like to send anybody my way. Currently, the way we're recruiting is through Epic Records. This is not the correct slide. We did a Epic query and received a list of names that we've been going through. And I know some of you have seen me bugging you through Epic Chat, asking to, if it's okay to contact participants prior to actually contacting them. But we do have a recent IRB approval, which will actually allow me to direct message participants through chat. Any questions?
Rose, there were a few questions, but I think you answered them. And Darcy had a question that I think is a burning one for providers now, with people who have that isolated core antibody positivity, and what to do with them. Should they be vaccinated? Should they be considered protected? And Connie responded that she will bring this back, bring the feedback to the study team, because it's another group that we're like, well.
Yeah, it's been a question for decades that has not yet been answered by the hepatitis B investigative community. So, there's been this broad assumption that by having isolated core antibody, it suggests that you've been previously infected and that you're protected at least partially, but I don't think there's any definitive or convincing proof of that. So it's definitely an ongoing question, and I think would be great to bring that back to the team for further consideration.
And I think Darcy is in transit, but she's making another great point, as is often done by Darcy, that as we increase our use of tenofovir sparing regimens, the concern becomes even higher potentially, because now people who maybe, had some protection with their tenofovir may not have that anymore. So very topical, very timely. Connie, we trust that you will do something. Make it happen.
Hey, yeah, I just flick my wrist.
Isn't it just a wand? Isn't that? That's what I do.
Yeah. I need that magical wand.
I'll get you one. I know they've got some on Amazon.
Harry Potter fans out there who have a spare wand. Anyway, yes, it is a great question. And like I said, it's been an ongoing question for decades. I don't know why the hepatitis B crew hasn't been interested in addressing it. I don't know if Lalo's on the line, but maybe he has more info from his hepatitis clinic, but I think he's mostly been dealing with hepatitis C.
Don't see him on. Anyway.
Well, before we move on, I just want to do a quick plug for an event that we have next week on April 21st, which is Thursday in the evening. A little collaboration between the AVRC Possibilities and Scripps, more so Scripps, specifically the RID HIV group is putting on a HIV cure research update at the San Diego Central Public Library. It's going to be in person and via Zoom. And so I'm going to put a flyer in the chat as well as a bit.ly link if you'd like to register. That way, if you want to come in person or come via Zoom, it'd be great. We're going to have Dr. Sumit Chandra speak as the main speaker. And then there's going to be a little section done by Dr. Karine Dubé as well. So look for that. Thank you very much. And then last but not least, we're going to move on to Crossby.
Hi, thanks, Marvin. And thank you, Roundtable, for having us and having this form of presentation. My name is Crossby Vargas, and this presentation is a brief one about studies at the UCSD HNRP. I've been there for it'll be 18 years in June. So what I do there is outreach talks in English and Spanish, such as this one. And both Susanna and I also do recruitment and screening folks for enrollment into our studies. So let me see if I can share my screen. And I will begin my presentation here. Does that show up full screen to everyone?
Yes.
Okay, great. So yeah, just a brief overview of our studies, who we are, what we do. And if you have any questions, as you know, Jill and Marvin are monitoring the chat. We appreciate you typing your questions in the chat feature. I work with Susana Concha Garcia, who is also an outreach representative, and will help answer any questions during or at the end, or even if I have to figure it out and then get back to you, I will do that. Located in Hillcrest, right next to AVRC. Our main focus is the effects of HIV on the brain. We examine relationships between HIV and aging, HIV and memory, as well as HIV and co-occurring conditions like hepatitis C. And of course, let me just get out of here real fast. Am I able to stop sharing real fast? I'm just going to put our website in the chat room. And this is in the event that anyone wants to go in and look at our website.
Do you want to resend that to everyone?
Oh, sorry. Yeah, to everyone. Got it. Perfect. Hopefully that went through. And thanks, Marvin. I'm just sending it privately to Marvin. He already knows our website.
It's good.
Go ahead.
Oh, I just said it's good. We can see it.
Okay, great.
Yeah.
Okay, I'll share my screen again. And continuing on, I will continue with my presentation here. So we also study substance use like meth and alcohol, tobacco, cannabis, and the effects of HIV in combination with, we have an organ donation program, as well as a last gift program, which includes tissue collection and full body donation. We enroll adults that are HIV positive as well as HIV negative as controls. We're interested in all genders, races, ethnicities, and different backgrounds. We also provide compensation to our participants for their time and effort. Best thing to do would be to just refer folks to us, and we'll do our best to screen them and get them into as many studies as possible. Some overarching programs that we work under, it houses several centers, including the flagship center, HNRP, or the Neurobehavioral Research Program. And also our Translational Methamphetamine AIDS Research Center, also was known as TMARC. We still have our initials up on our acronym on the side of the building there. CNTN is our California NeuroAIDS Tissue Network, where we do organ donation and autopsies. That's part of a nationwide network. And Charter and the Center for Medicinal Cannabis Research, also known as the CMCR. So, what confidential interviews is basically what we do with the participant over the phone. Then we do another second interview with them over Zoom. So it's a kind of a two-step process. The first one is just to see if they qualify for anything. The second one is to see specifically screen them for specific studies. We do paperwork, medical assessments, cognitive assessments. There's optional components such as like the lumbar puncture, which we're famous for, the MRI, the PET scan. We collect saliva, we collect stool. It may involve equipment. We may lend out equipment such as cell phones, Fitbits, virtual reality glasses. They might come in and do driving simulator. There might be study medicines such as Tessimoreland, cannabis, also Pirenzepine. Study food if applicable. For the diet and exercise study, we randomize some folks into an arm where they receive olive oil, walnuts. Move on. Some of our current studies. Cannabis and neuropathy. So we're looking at, the purpose is to assess possible effect of cannabis on neuropathic pain. This 6-month study is enrolling folks that are HIV positive only and have HIV related neuropathic pain. Here you can see that it's they have to be HIV positive and over 18 for this study. Here we have a 1-year study called Tessimoreland, or also known as Agrifta. It's an injectable medication that's already FDA approved for fat loss or weight loss, but we're trying to see if there is an additional component. For this one, we're studying folks 40 years of age and over with abdominal fat. They can be Spanish or English speaking, but they must be HIV positive. There are multiple in-person screening visits, which are split up into Zoom and in-person visits nowadays. If eligible, participants may be randomized into the immediate group where they get the Tessimoreland drug immediately. The other group is called the deferred group, and they also get the drug, but it'll be 6 months down the road. Each will be trained on how to inject themselves, and they'll receive daily text messaging for self-administration purposes. Of course, they'll be trained with, they'll be trained with a saline solution prior to going into the real deal. And it compensates up to $635 for their time. Another 1-year diet and exercise study. Just keep in mind, participant can't do both of these due to the nature of them both being intervention and also weight loss studies. This is a diet and exercise study where they could randomize you into a Mediterranean style diet where 12-month study designed to assess ways to increase moderate physical activity and improve diet in people living with HIV. We're enrolling folks that are HIV positive and have the desire and ability to increase the amount of steps they take every day. The initial eligibility is about 2 hours long, and there are some in-person visits, not many. A lot of them are telephone visits and Zoom, and we also lend out Fitbits, accelerometers, and participants can be provided with a phone if they need one. But if they're randomized into the Mediterranean, they get a dietitian and they also get some walnuts and olive oil. Next study. We have a nicotine study. For this one, it says, and non-smokers wanted, but we filled that cell. So we're actually looking for HIV negative or positive cigarette smokers only. And they're looking on the effects of nicotine on brain inflammation. It involves one baseline visit, which is about a full day, like an 8-hour day, but we do split it up. So they don't do it all in one day. They do it in several visits that is split up between Zoom and in person. And then some participants are asked to do an MRI and a PET scan. That would be in La Jolla on a separate day. Not all participants qualify for that component, as you know. And at this point, we only need smokers, but at the baseline visit, they could get up to $90. And if they complete the MRI and PET scans, they could get an additional $177. Let me see. Okay, so some new studies that we have. Pirenzepine, a study on neuropathy and HIV positive folks for folks between the age of 18 and 80. They're looking to study the safety and efficacy of this new topical cream on the skin, formulation of a drug to treat neuropathy. IMNO is a study on HIV and depression. You can be HIV negative or positive for this one, with or without depression. And it's one of our loosest, probably, criteria studies that we have to develop pathways leading to future treatments for depression in people living with HIV. Mobile toolbox, it's one for HIV positive only and 50 and older. To validate a newly developed mobile toolbox, CDC developed, I believe it's CDC that developed it, to determine a neurocognitive disorder or hand in folks who use it. It would be something that they download on their phone. CHIP, 18 and over, they can be HIV positive or negative. At this point, we're looking at moderate to heavy cannabis users for our cannabis studies. We've filled a lot of the cells for folks who don't use cannabis. We're looking for the moderate and heavy users. Anyways, CHIP, a study on cannabis inflammation in the brain to learn more about chronic cannabis use in people with HIV. CAP-K, HIV positive, 18 and over, on stable ARV regimen for at least 6 months. Could be anything, they just have to be on it for at least 6 months and stable. A study examining the effects of cannabis use on the art therapy and metabolism. MEIH, it's looking at how cannabis use affects gut health in people with HIV. And these are very brief descriptions, obviously. These are new studies. Our COVID study, they would have to have had COVID and be a prior participant here at HNRP or be referred directly to us. And it's a study where they get surveys every month, and then it changes the frequency that they get them, but they get these surveys where they get compensated after completing them, but it just wants to understand how COVID-19 is affecting their daily life, their thinking skills, looking at factors associated with contracting and worsening COVID and how they felt before COVID as opposed to now. Anyone that wants to find out if they qualify, they can call our number, and that would initiate a brief screen. That would be just us talking to them over the phone and getting some basic info on them, or if we know them, seeing what else is new or what updates there are on their medications or whatever. We then review that with study investigators, and that would be the PIs running the study. We do that in a secure intranet fashion. That is not, it's completely, we don't use any PII. We just describe the basics. So the PI will make the decision, yeah, let's bring them in for the full screen. In that event, we would do a virtual screen over Zoom, that could take up to 2 hours for the diet and exercise study, but it usually takes about 45 minutes. And we gather all their medication and everything, and we have them sign consent forms. But we can also do this in person. We used to do it in person, obviously. And what does a full confidential eligibility visit look like? We review the details of the study with the participant. We discuss and sign consent forms, complete questionnaires specific to the studies that we're considering them for, and answer any of their questions. Of course, we also let them know which ones they qualified for. We review the screening eligibility documents with the doctor or coordinator. The PI or coordinator determines their eligibility. Then we schedule their baseline visit roughly 2 weeks or less from their Zoom visit, and they're called by our scheduling department, and that's it. HNRP adheres to the COVID guidelines, so the safety of our participants is paramount, and staff, of course. So we have reduced staff on site, and I'm working from home, for example. We clean, sanitize between all participants, between all visits, and in all rooms. We have a negative pressure room, we're lucky because we had these cannabis studies. We had installed a negative pressure room already, but now we use it as a COVID deterrent because the tester and the participant can be separated by a glass, but still see and hear each other real well due to the microphones and the way that it's set up. So yeah, please have any of your interested parties call our front desk. They can leave a message there. Just to let you know, there's no one really answering that number there, but please do leave a message, and we respond to all messages with a working number, and they can leave an email. And you can also leave messages with us directly at our direct lines, Susana 543-5098, mine is 543-5020. And ask, in that case, just leave a message and we will call you right back. Any questions?
Crosby, there were a bunch.
There were a bunch.
Some I think were answered already. I think the first question came up related to neuropathic pain. I think that was the cannabis neuropathic pain study. So how do you determine if the neuropathic pain is HIV related? Sure.
So there are numerous questions that we ask at the pre-screen to get a timeline of when the onset of neuropathy came on, and whether it was pre or post HIV, as well as the neuromedical staff doing physical assessments on the participant to assure that even if they do or don't have a diagnosis of HIV by their primary, we make our own assessment. And it's really our own neurologists that say, yes, this person is eligible due to what I found, regardless of diagnosis.
Thank you. There were a lot of questions about the Tessimoreland study, but I think Dan answered all of them, I think.
Tessimoreland
there was
study?
A question. Yeah, I think Dan Lee addressed the questions.
Oh, great.
Yeah, in the chat. Robert Dice asks for the smoking study. To what extent is smoking cessation, counseling / medication a part of the study?
That's a great question. Yeah, it's not part of this study. We're actually not trying to get them to quit. We're looking for smokers who smoke a minimum amount of cigarettes per day. So they've got to be.
Sorry, I don't mean to laugh. But I get it.
Pretty
Yeah.
committed, yeah, to smoke.
Right, you got to be real committed to your cigarette.
I know it sounds terrible, but
Yeah.
you know, I thought that there were no smokers left until I had a gig at a casino a couple of weeks back, and there they all were, and they were all smoking indoors. It was insane.
Yeah.
I thought to myself, I should have brought my niche flyers, but of course I'm not there to do that.
I have a question because I didn't see it listed, but I think it comes up with a lot of our patients, with severe/refractory depression, any studies with ketamine coming down the pipeline that you know of?
Not that I've heard of. It's not to say that there aren't, because I'm not in like the director staff meetings or anything like that. But I haven't heard of anything, Jill, and I'll let you know. So what were you looking for, like ketamine as a form of treatment?
Yeah, as you know, either adjunctive therapy. I'm not a psychiatrist. I'm looking for some of our, I don't know if Dr. Grillotti is still on the line.
Sorry, I missed the question.
I brought up the issue about ketamine studies involving ketamine, and Crosby asked, what exactly do you mean? And I was like, well, as an adjunct or just where to ketamine, are there studies with ketamine and what do those look like? And do you know if anything's coming to the HNRP soon at some point?
It's being it's in process, but there's no funding, and there's no good community site that I know of to get somebody who isn't able to pay cash to get ketamine treatment, if that helps. People are also interested in psychedelics, and that would be a really great thing for us to do as well. And there is a psychedelic research center at UCSD, and they have psychedelic studies off and on. We've had some success. I've had some success referring patients there, but I do not believe they have any active studies currently that at least is relevant to psychiatry.
Thanks, Dave.
Thank you. Well, thanks everyone. I really want to thank you for your time, and if there are no other questions to this. So Dan Lee, thank you for answering all the Tessimoreland questions, Daniel. And I will, thanks. So yeah, if there are no further questions, I guess you can get back to work a little early.
Crosby, the only thing I'd say is just because there's so many studies going on under the HNRP, I was excited, but also overwhelmed. Sometimes I think some of the best ways to do this now is, do you have a QR code that's attached to something where it brings people to here are all the studies we're doing?
Yeah, that's great.
Is that something you have on a flyer? Because again, we can't hang 10 study flyers in an office, but we could do one saying, we have all these studies. Here's a QR code to learn more.
You know what? It's been mentioned in some of the meetings that are related to data, which would be the team to kind of spearhead that. I don't know where it is in the process, but it has been at least mentioned. I don't know exactly, but that's a great idea. And I think that that's the best way to not fill a whole cork board up with flyers and just, because that was the old way of doing things. But now there's so yeah, we'll work on that. And thank you for the reminder. So I'm going to bring it up again and see where we're on that QR code.
That's what I'm here for, to help solve problems. Get Connie a wand, get Crosby some QR codes or idea for a QR code. Does anyone have any questions either for Crosby or any of our presenters?
No, I'd just like to thank the presenters. I know sometimes it's anxiety producing for everybody to do presentations when they're not used to doing that. And we thought it would be a great idea to have our research coordinators be an integral part of the presentation. So thank you all. You did a great job, and we really love that you're engaged with your studies and willing to present to a diverse group of people like our audience tends to be. I think we'd love to have more support for a lot of our studies from any of you out in the audience. So we hope to be doing something like this on a regular basis. So thank you everyone for your attention.
Thank you for having us. We really appreciate the opportunity to speak on our programs.
That's Marvin's idea. So Marvin, you get the credit.
Thank you, Marvin.
And I think you can see all the praise coming in. So many claps and so many messages. This is probably, I mean, not to, everyone has done great presentations this year, but this might be one of the best so far in 2022. So thanks everyone.